Good afternoon, everyone. Thank you for joining us today. Our Facebook Live today will cover contact tracing. With us, we have Rebecca Roslet, who heads up our team here of contact tracing. A lot of people have heard the phrase contact tracing, so we'll really go over what it is, what you all do, and why it's so important for our plans moving forward as we slowly reopen Boone County. So first, if you want to just kind of give an overview of what you guys have been doing so far.
So just to get everybody up to speed on what it looks like on the end of the investigators and the contact tracers, when there is a new case, and a case would be somebody who's had a positive test for COVID-19, when there's a new case in Boone County, we are notified either by the provider, the medical provider who ordered the test, or by the state health department, or by the lab that processed the test. So one or sometimes all of those individuals will notify us when there's a positive result, and then our first responsibility is to contact the person who had the positive result, and they're referred to as the case. So we have a responsibility to call the case, see how they're doing, see what questions they might have, talk to them about isolation guidance, because if you are the case, that means you've been infected, and so you go into isolation, which is different than quarantine. Quarantine is for those who have had a potential exposure to an illness. Sometimes those two terms get used interchangeably, but isolation is for somebody who's had a positive lab result. So we're going to talk to them about what they need to do at home to keep themselves healthy and those around them. And then what we're also going to focus on is we're going to interview them about all of the close contacts they've had. And when we're looking at the time period where we need to identify close contacts, we are looking at from the time they first started to have symptoms, from that date until the date they had their positive lab result, the date they were notified, as well as the 48 hours prior to becoming ill. So for example, if you were to start to have symptoms today and you got tested tomorrow and I call you on Sunday, I'm going to go back to at least today, but I'm also going to ask you, who were you around on Wednesday and Thursday? Because I need to identify anyone who was a close contact to you. And a close contact is going to be somebody who was within 6 feet of you for an extended period of time, which is 15 minutes or greater. So after we have identified those individuals, then we move into the contact tracing period.
Yeah. So let's give some examples of what those close contacts might be.
Sure. So let's use you as an example. So if you're the case, first I'm going to ask you, well, who lives in your household with you? Because they would have most likely been within 6 feet of you in the 48 hours prior to when you had symptoms up to this point. We also have cases who are asymptomatic, which means they feel completely fine, but they've still had a positive lab. So in those cases, their onset date that we use is the date they had their lab done. So if you had your test done today, you've had no symptoms, but your test is positive, we're going to go back to today again and the 48 hours prior as we're looking at that time period. So I'm going to ask you questions about who's in your household with you, what have you done in the last few days, kind of walk me through your days. Have you been to work? What kind of work do you do? What's the work environment like for you? Or do you share a cubicle with somebody else? Or are you in an office all alone? So we're really going to get down to some details about you and your interactions with other people. Do you have a significant other? Did you have dinner with friends? Those are the types of questions we're really going to walk through with you. And then we're going to ask you to give us those list of names as well as contact information for them so we can follow up and let them know.
So once you get this list of contacts, how does the contact tracing process work for those contacts?
Sure. So for example, you have a roommate in this scenario that I'm making up. I would then contact your roommate and I would say, roommate, we've been notified that you were a close contact to somebody who tested positive for COVID-19, and I am then going to talk to you about, are you having any symptoms? and discuss quarantine with you, because you would need to be in quarantine for 14 days since you last had close contact with the case.
Okay.
So if your roommate had not seen you for 5 days, like they've been out of town for 5 days, if it's still within that window of when you were contagious, they would be in quarantine starting the last day they saw you.
Okay.
So what oftentimes happens is that people are in close contact until they start to feel bad. And so then they often will start their isolation on their own without even having their test results yet, which is great.
Yeah.
Because then that reduces the length of quarantine for their close contacts. So I'm gonna make sure you've been notified that you are a close contact. I'm gonna talk to you about your health and the signs and symptoms that you would need to watch for. We're also gonna talk to you about if you should have a significant change in your health where you need to seek emergency care. Whether it's going to the ER or calling 911, that you need to notify them in advance that you've been exposed to a positive COVID case so that they can have the appropriate gear on when they interact with you to reduce the likelihood of transmission. We're going to do a lot of education about why quarantine is good, because sometimes it's hard to get. If you feel fine, why do I need to stay home for 2 weeks?
Right.
And then we're going to talk about following up with you every day during the course of your quarantine, because we want to continue to monitor you and see if you have any symptoms develop. In our county, we also recommend that those that are in quarantine have a test on day 5 of their quarantine and on day 14. Mm-hmm. And that helps us to identify somebody who might be infected, not just exposed, but actually be infected, as well as anybody who may be asymptomatic, but yet still positive.
Yeah. I think, with contact tracing, it's really important to remember, we're putting the active cases on
Right.
our website, and right now, luckily, it's a pretty low number.
Absolutely.
But there are so many others with the contacts that
Absolutely.
we're keeping track of, and trying to make sure that they are all being as safe as possible.
Mm-hmm.
So a big question that has been asked is, do we have enough contact tracers?
That's a really good question. So there are some really good online tools that we have access to that have allowed us to kind of use the data in our population size and our case size to determine what's an ideal number of contact tracers. Currently on our team, we have 9 investigators and we have 5 contact tracers. Those online estimators say we should have 28 contact tracers. So our number of new cases at this point isn't such where we need 28 contact tracers. So we're fine with where we are. And we continue to look at others within our department that work for other programs and see if we can reallocate some of their current functions so that we can train them then to come on board as contact tracers.
Yeah.
So we're continuing to expand our capacity as our case count warrants.
Yeah. What is the benefit to locating those who have been in contact with someone who has then tested positive for
Sure.
COVID-19?
So I'll use me for an example on this one. So if I have been a contact to a case, it's important for me to know and to then go into quarantine, because the whole purpose of that, it's not to protect me, I've already been exposed. It's to protect my children, my coworkers, and my spouse in case I were to start to become sick or test positive when I don't have any symptoms. So you're trying to prevent that secondary transmission that can happen for those that are around you, either at work, wherever you might be a customer, church, family, all of those individuals. It's really for their protection, because in this scenario, I've already been exposed.
Mm-hmm.
So I just need to stay by myself, try to stay in my own bedroom if I can, only use one bathroom if possible, stay alone as much as possible. And then if I need to be in any high touch areas in my house, like for example, if I need to come out and cook myself some lunch, I need to really disinfect anything that I touch as I'm on my way back to my bedroom where I need to be quarantining. And that will really help keep my husband and children safe if I should become sick. And if I've been in quarantine and I do become ill and I've been isolated and I've been following the quarantine guidelines, then there's a possibility they might not have to go into quarantine. So they might be able to avoid that 14 days if we've been really strict with following home quarantine protocols.
Right. So I think it's been about 8 weeks now since we had our first positive case in Boone County.
Mhm.
So what have been some of the challenges in the case investigation and contact tracing process?
Sure. Challenges, we can't start anything until we get a hold of the case.
Mhm.
They are the entry point for all of the information. So sometimes we may get a lab report or a provider note that doesn't have accurate contact information, either an old phone number or no address. So we do a fair amount of time tracking people down. And also, we'll use you again for an example. So if I found out today you were a case and I call you and you don't call me back, and I call you again tomorrow and you don't call me back, and I call you again on Sunday I finally get a hold of you, well, I've missed 48 hours where I could have been reaching out to your contacts because I don't know who they are yet.
Right.
I have to find that out from you.
Yeah.
So just ensuring that people are willing to speak with us and are comfortable sharing that information. Sometimes people don't want to share that for whatever reason, and that makes it really hard for us to protect the health of the case as well as those who have been exposed to the case. Sometimes people will talk to me about themselves, but they don't want to share any information about anybody they've had contact with. Or we have contacts sometimes that we're not able to find, either because they won't return request for communication, or we don't have accurate phone numbers, things like that. So it's really just being able to make that initial connection with the case to get their information so that we can then notify their contacts. So it's all about communication and trying to reach people and speak with them.
Yeah. What are some things you want the public to know about disease investigations and contact tracing?
Probably the biggest thing is that investigations are confidential. So sometimes that is really upsetting to people when they feel that I think you have it and I think I'm a contact and I want somebody to verify that for me. Well, we can't do that because I can't verify that you were a case, and the person who thinks they're a contact, they may or they may not be. If they are, we're going to reach out to them and make sure they know. Mm-hmm. If they're not, I can't really say that because I can't say that you were a case. So confidentiality is hands down our biggest challenge, but it's also the thing that is very important to us in public health. The cases information, that's their protected health information. So we cannot share that. It's also sometimes a challenge. We need to ensure that we protect their identity as much as possible. So, for example, if you're the case and I find out that you work in an office with just one other person, but that person's a contact for you, I'm not going to call your coworker and say, Julie, I heard you have had an exposure at work. Because now Julie knows it was Ashton who had it. So sometimes the information that we're able to share with the contacts is purposefully vague, and that's to protect the privacy of the case. Mm-hmm. Also, sometimes there is a lag in time between when the case knows, because we're not the first people to know. Usually the medical provider who orders the test will reach out to the case and let them know their test results, which is the way things should go.
Right.
So then there could be a period of time that passes before we even know, which is fine. The case knows, the medical provider gives them immediate instruction on quarantine, or isolation. But what that can sometimes lead to then is that you may have called all your friends and said, I tested positive for COVID. But you're not returning my phone calls, so I can't confirm who you've been around. So then we can have a real communication gap between those who have been notified by the case that they're contacts and our inability to have that same information from the case directly. So sometimes that's a challenge too. Just it does not always move as quickly as we would like it to.
Yeah. On our website, we have the modes of transmission broken down for our for all of our positive cases. Can you explain a little bit about why some of them might be labeled as unknown?
Yeah, the answer is we actually do not know. So person-to-person transmission would be if you're positive and then 5 days later your roommate becomes symptomatic and tests positive. That's a contact to a case because they are a contact to you and you're a known case.
Right.
When we first started, we had a lot of travel related because people were traveling home from areas, other parts of the world, that had high rates of transmission. So we connected that to their recent travel. And sometimes we just have no idea. Like part of what I would be asking you during your case interview is, well, where have you been in the last couple weeks? Have you traveled anywhere? Has anyone in your close circle been sick? You know, do you know if you've been exposed to this? And our reason for that is not to go way back 2 weeks and call all those people, but I'm trying to figure out where you picked it up. It's just for that reason. So we have an idea whether do we have widespread community transmission, or are cases really closely related to a family unit or a particular work environment or travel to a particular country.
Yeah. We've talked a lot about how community transmission is one of those things we are watching heavily as we move forward. Can you explain how community transmission is defined and why it's so important to look at?
The important with community transmission is that it's harder to mitigate. Our mitigation standards with the social distancing, that's to help keep me from getting it from you, if you may have it. But when it's widespread, it's everywhere, it's in the community, like some other virus, like the seasonal flu might be. You know, it's that time of year, you just expect you could be exposed to influenza.
Right.
It's harder to put processes in place to slow that down.
Yeah, that makes sense. I think that's all the questions we have planned for today. Was there anything else that you really want people to know as we move forward and your team continues tracing?
If anybody from the health department calls you, please return our call.
Yeah.
And if you are a case, it is really for the health and safety of those that you love and you work with and that you're around, that you share with us their names and their contact information so we can help keep their loved ones safe, because that's the whole point of quarantine.
Yeah. We did just get a question, can you give the symptoms for children who may be experiencing COVID? That might be a question we have to ask Dr. Ashley.
That would be a question for Dr. Ashley.
Yes, so we will reply to the comments after we pass your question on to her. I know she has way more knowledge about those things as I do, that's for sure. All right, I think that's all for today. Thank you so much for joining us.
Thank you.
If anyone has any questions, you're welcome to email us at coronavirus@como.gov, and we will do our best to get back to you as soon as possible. And we will be back next week. Thank you so much.